Prevention mobile application. The A stands for assessment, the P stands for provider, the second P stands for pharmacist, the third P stands for physical therapist, the N stands for nursing, the F stands for family, the E stands for education, and the S stands for sensor. The World Health Organization defines a fall as the element of coming to ground on a lower level surface. A fall is a global health problem affecting the entire world, with highest mortality rates in adults 65 and greater. So let's get a thorough description of the problem. Falls among older adults and the elderly is a common issue in most skilled nursing facilities. Patients who are admitted to a skilled nursing facilities are at an increased risk of falls due to recent hospitalizations and often present with decreased mobility following a recent hospitalization, which could be due to strokes and other acute illnesses. Falls with injuries occurring in the older adult population can be very devastating to the patient, both physically, emotionally, and financially. As previously stated in the previous slides, we have a thorough understanding of what the problem is. The problem is the increased fall rates in skilled nursing facilities among older adult population. And what is a possible solution that can help eliminate, if not eliminate, help reduce the rate of falls among this population? The solution that I have today is the innovation of the Fall Prevention mobile app. The Fall Prevention mobile app will aid in predicting fall risk patients. It will also help in a proper assessment of patients that are at risk of having a fall. It would also prevent the physical, emotional, and financial burdens that we incur as a result of the falls, not only on the patient, but also on the families that are involved. And not only on families, also society as a whole, because in turn, we are the one that are actually paying for the hospitalization, the increased hospital stay, and then disability that can occur as a result of the falls. It also will increase the patient's dependency. It will also decrease negative citation and significant fines that most nursing homes incur as a result of multiple falls with injuries or falls that can result in a patient actually losing his or her life. It'll also foster interdisciplinary collaborations among physicians, pharmacy, the family, nursing staff, which is very, very essential in the whole solution that we need in eliminating falls among this special population. Attached in my PowerPoint presentation is a little clip from YouTube, a YouTube video just showing you the background and significance of what falls can do in older adults, as far as like the fall rate, the hospitalization, emergency room visit, and how much that we actually pay as a result of all the falls that happens to our older population. Background and significance continued. Just a little bit that I just want to add to what the YouTube video had. The Centers for Disease Control and Prevention reported in 2014, older adults in the United States sustained 29 million falls, attributing to 7 million injuries and costing an estimated $31 billion in healthcare costs. That is so much money that we're spending on something that we can prevent. Due to the increase in the older adult population, the number of fall-related injuries and death is expected to increase. So injuries resulting from a fall increases healthcare costs, as stated earlier, due to additional use of resources, thus increasing the length of hospital stay. It's like a vicious cycle. So unless we find a solution to this problem, it's just going to be like I said, a circle that keeps going and going and going. Older adults who fall without sustaining any physical injury also develop psychological fear of falling, thus causing them to decrease their activity. which in turn decreases their mobility and actually increases their chance of having a fall. Like I stated earlier, it's like I feel like I'm saying the same thing verbatimly over and over. It is a vicious cycle that needs to be eradicated, that needs to be stopped, that needs to be prevented. So let's talk about the past solutions that are currently being used in preventing falls. In addition to mobile apps or technology, we've used sitters in the past. That's actually having somebody come into the room and sit with a patient that's at risk for falling. We've used like toilet implants. Some people have utilized Allie rounding, which they use every hour. They go assess the patient. But as far as mobile apps, the current one that I've seen is I have 3 examples that I'm going to talk about. Is the Sparrow app, which actually uses like a sensor they apply to wheelchair, and which communicates with an Android mobile device, and it lets the caregiver know the movement and posture of that particular patient at all times. Although this is a very good fall prevention tool, limitations that I see in regards to this app is it's limited to patients in a wheelchair, and not all older adults utilize a wheelchair. Some people are able to use a cane. Some people are able to ambulate independently without any assistive devices. So I think there's a limitation in that aspect. The second one is the Canoptum. It's a subsystem which consists of telemonitoring system, rehabilitation, and gaming camera movement unit sensors. This is actually a very good system. Very, very good system. I'm just going to be a little partial to it and said the limitation for this system is it does not include hourly rounding aspect, which I have included in my innovative mobile app. It doesn't have access to billing and documentation in the EMR system, which is very imperative because if we're doing this teaching in a nursing facility setting, we have to be able to bill for it and we have to be able to document for it. The other third current solution is the H&Fall application. It's actually not being used currently because they need more research on it, but it's a program that is in the works, and it actually allows the individual or patient to do a self-assessment and the monitoring of their own fall risk. So they are aware. It creates a sense of autonomy. They're able to individualize that, okay, I'm at risk for having a fall, and so I know that I'm a fall risk. But the limitations to this is it's just limited in the screening part. But as far as intervention, there is not much intervention. It's limited to, there's no education, there's no fall risk assessment. It lacks intervention, which we need. We know that you're at risk for fall, but what are we going to do? What is the solution? And like I just said, that is my major impact. What are we doing? Because we know that there is an increased risk for fall, but what is the plan of action? Like for any innovation to be successful, it needs the collaboration of a team of people from different areas, different fields, bringing new insights, new ideas, to be able to come to a solution to the problem. So the people that I decided to collaborate with in creating this mobile application is, of course, the nursing home administration. I collaborated with the nursing home administration because he is the highest leadership. He holds the highest leadership position in the nursing rehab center. So I need to collaborate with him. He has to be aware of any changes that is going on in his building. He also manages the entire financial budget, which is very, very imperative to the implementation of anything that you want to do, because he manages the budgets. How do I finance this new mobile app? So I need to go collaborate with him. So that is why I included a nursing home administrator as part of my collaborative team. The second person that I also collaborated with is the nursing unit manager. I personally chose the nursing unit manager because I know as a nursing manager, she has experience of being a frontline staff. So she's been on the floor. She knows what it is to be a nurse on the floor. She knows what it is that we need. She has a leadership role as a manager. So I felt like I needed to have her inputs in deciding what mobile solution to actually implement. The third person I collaborated with is the physical therapist. I did this because, they assess all our patients on admission. They do a thorough screening and evaluation to throughout their nursing home stay. And they also are able to have an individual care plan for that particular patient. And they see the patient, because it's mostly what leads to patients' fall is the decrease in the gait. They're not able to, they're weak, and who can better increase all those exercises if it's not for physical therapy? So, okay, what was the benefits of having this dynamic trio which consisted of the administrator, the nurse manager, and the physical therapist? What I got from the nursing home administration, which I am going to implement, is he was more concerned about the financial aspect. Like I said, he manages the budget for the entire nursing facility. So he was worried. He wanted to know, how do we capture or build this mobile application where patients are in the nursing facility? And he also wanted us to make it user-friendly if we were to implement this new mobile application, which is very, 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 very important, because we cannot be seeing patients, talking to patients, and not have a way to build them. The unit nursing manager also wanted for me to include in this mobile app not only patients that are able to use the mobile application, but also for demented patients are Alzheimer's, and maybe long-term care patients, which I plan to see how I can incorporate that in the future. And she was also very concerned about nursing documentation, which is very, 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 very important. As most nurses, because we have a nursing background, we're nurse practitioners, we know that if you do not document, it was never done. Even though you spend like 30 minutes with that patient, if it's not documented, you didn't do it. So how do we capture this documentation that we taught this patient about mobile application, or you saw the patient utilizing this, which is an area that I also plan to look at. The physical therapist has some great input and idea, which I also, two of which I decided to go ahead and utilize and add to my implementation of my mobile app. She stressed the need that we need more clinical studies showing like the validity, the reusability, and the efficacy of all of this mobile application. Like we don't have enough research saying that, okay, this is good, because they're still currently in the works. And she also talked about the need to have an actual therapist make the initial assessment, and then moving forward, we can have like a therapist go online where they can speak to the patient, but the initial assessment needs to be done by a physical therapist. So like I stated earlier, there is a very good chance of a successful implementation in any innovation when you collaborate with others. So the benefit of collaborating, like I stated earlier, the administrator input regarding capturing the financial aspect, I plan to incorporate. The physical therapist stressed interoperability, user-friendly, which means like we need to also add like additional incentives for the older adult to continue to use it, such as gaming exercises. We also have to have like incentives such as rewards for them to continue to use this. The nursing documentation aspect, like I stated also, we have to find a way to capture that so the nurses can get credit for what they're doing, for the education that they're providing. The APPP-NFES for Prevention mobile application is available via Android and Apple phones, will be available, because this mobile application is something that I created on my own based on past mobile innovations, which I just felt like needed more additional interventions in helping alleviate these problems that we are having. It's going to also include a fall risk assessment using the Hendrick fall risk model, which is a tool that's been proven with evidence-based, saying that it's an essential tool in predicting adults' risks of having a fall. It will also incorporate physician accessibility to view fall risk assessment scores, physical therapist evaluations and screenings, pharmacy medication reviews, hourly rounding checks performed by nursing staff will also be implemented in the mobile app. Sensors detecting patients trying to get up and actual falls will also be implemented in the mobile app. Patient and family education in regards to means to help decrease falls measuring data analysis that depict an increase or decrease in falls via the EMR system, which can be used as QI, increased sustainability, the use of incentives and gaming exercises provided by their PT, evaluation and OT recommendations. We're also going to incorporate colorful pictorial icons, which keeps people interested in using the mobile app. And also we're going to add the ability, it's going to incorporate the ability to collaborate with all interdisciplinary teams via the webcam. The physicians can talk to the therapists. Therapists are able to collaborate with the pharmacist. Pharmacists are able to collaborate with the patient. Patient is able to collaborate with the family members, etc. We're also going to incorporate a web-based camera, videos, unit sensors, like I stated earlier, to help detect a patient trying to get up, and also actually detect when a patient actually falls. And when a patient falls, it can also alarm. It will have an alarming system to the nearest 911. So again, this is basically talking about the innovative features in my APPP and FES. It's going to have the ability to assess for risk utilizing a mobile application. It's right on your hand. It's right at your fingertips. Ability to access medication lists and have both the provider and pharmacist perform a med review, which helps to decrease or eliminate polypharmacy, helps to decrease when you take your diuretics, which might increase your chances of having a fall, help to determine when you take your blood pressure medicines, which also increases your chances of having a fall. Instead of having it 10 a.m. and 10 p.m., we can do 9 a.m. and 5 p.m. So we don't give it to you at night when you get up and try to use the bathroom, and then increases your chances of having a fall. Access to physical therapist evaluation scores and performance results. So it's right there at the tip of your hand. The therapist will make his or her own evaluation. There will be a score generated, and the physician, the pharmacist, everybody, all the interdisciplinary teams working with this patient are able to access those results. There's going to be a structured individual exercise, which is care planned by therapists. Documentation, billing is captured through integration into current EMR system. The current EMR system that we're using at the nursing facility is PCC. So my plan is to try to incorporate somewhere in PCC where we can get where the nurses can go in that has a section that says mobile app documentation, where we can go in and actually document and bill for educating the patients or family members in regards to this new mobile app. We're going to also they're going to have access to the hourly rounding performed by nursing staff using the 4 Ps. QI will also be able to gather data depicting fall rates on units, and the results can be also shown in the mobile app. Education on falls and fall preventative intervention again. According to CDC guidelines, education is according to Healthy People 2018 to 2019, which needs 2020. We need to include all those so family members can be updated continuously as far as like new implementations or new preventative measures in decreasing the falls in this older adult populations. It's going to have sensors predicting an actually alarming healthcare team, family members of potential and actual falls. And as stated earlier, if a patient does happen to have a fall, there's supposed to be a sensor that I'm planning to implement that can reach that automatically calls 911, and the patient is able to communicate using their mobile phone directly to 911. There are also incentive programs, as stated earlier, to increase the older adult actually using this mobile app. We're going to use gaming exercises so they're able to see themselves performing these exercises, which also gives them a sense of pride that, okay, I'm doing this. You're going to see points rewarded, incentive points for them to say, okay, I'm not going to get bored. Let me just continue to use this, And we're also going to use camera video system whereby patient can interact with the healthcare team as needed. Thank you very much, and here are my references.